These treatments for end-stage heart failure, heart transplantation, and assist device or mechanical circulatory support come with their own set of issues. So it's a little bit different from an aortic valve replacement where we replace the valve, you can kind of forget about it and go on with your life. It requires a big commitment both from the patient and their family and the treatment team. And often there is a long period of time between the time when you've gone through the evaluation process and been identified as a transplant candidate and listed for transplant before you actually get a transplant. And so that time is characterized by a tremendous amount of communication, both over the phone and in person and clinic visits, and careful monitoring of the patient's status to make sure that they're not slipping and getting worse and need speeded up or augmented therapy.
The bridge to transplant means that if we think that they are not eligible for heart transplantation at the time we see the patient, in order to bring the patient to the state that they can be eligible for heart transplantation, we bridge with mechanical circuit support, such as the left ventricular assist device. There are a lot of different types of mechanical circuit support. The less invasive mechanical circuit support is called intra-aortic balloon pump, which can be inserted through the groin percutaneously. The largest and the most robust mechanical circuit support is called implantable left ventricular assist device. It's implantable, you can go home with it and be supported for a long period of time.
When a patient gets a therapy like a transplant is in some ways dictated by how sick they are. Their priority on the transplant waiting list is determined really directly from how bad their heart is and how sick they are overall. So that really dictates the need for really close monitoring and communication so that as the patient gets sicker, we can monitor that, identify that, and upgrade their status on the list to make sure they get the heart transplant at the right time.
We have everything to get the best patient outcome. We have one of the best 3-year survival rates after the heart transplantation in the Western Pennsylvania area.
We're absolutely committed to identifying the best therapy and providing it in the best way, but also in the communication and just the care and the way in which that those treatments are provided to make sure that we meet patients where they are, meet families where they are, communicate really well, and try and provide the best possible experience for patients in what is often, really scary and challenging time.